My name is Marilyn Poynter and I'm a dentist in Harley Street. My practice is dedicated to looking after patients who are from normal patients to the very anxious and phobic patient. Their age ranges from very young to the very old. My area of expertise really lies in looking after and treating the dentally anxious and phobic patients. The KC patient education system was something that I come across in my professional journals. I loved the way it was presented. I thought it was extremely professional, far better than I can relate to my patients myself, because with all good intentions, I get bogged down in terminology. And although the patients like to say that they can communicate and understand what I'm saying, you know, it sometimes is above their heads. And it's my kids who are actually saying, "Mummy, what are you talking about gingiva for when it's gums you should be talking about?" And I've got to realise that I can get off on that bandwagon. And I thought from that point of view, KC was good. It brought it back to reality. It was diagrammatic rather than gory. And all of my patients will say, that was time well spent, now when they look at it. So it's been a terrific investment for our practice. And we have reaped the benefits of it in the first 3 or 4 patients. And particularly any of the periodontal issues, which no matter how often you ask your patient how they're brushing, how well they're brushing, and when they see that stuff on the DVD, it brings home to them how important it is. And I think the little picture of the little microorganisms moving around, you know, it shows them exactly what's going on in their mouths, and they say, "Oh my gosh, is that what's going on? I really must do something about this." To explain situations and items of treatment to the patient in a way that I couldn't, with all the aids and diagrams that I can draw, to see something done in the tooth diagrammatically, to explain to the patient what's going on in their mouth in their terms that they can understand, it has actually reached beyond that, in that they can comprehend it, chew on it if you like, take it home, think about it and say, yes, I'll have that. So from that point, it's gone beyond my expectations. It's a very good sales item. With all the time in the world that one may have, and even in Harley Street when we're supposed to be, well, I am trying to, you know, get to the patient by listening to them, talking to them, informing them. I don't have time to cover everything, and there are going to be elements of treatment that even I can leave out. And what the DVD does is it gives them all the options in a nutshell. Even the clerical staff, with all due respect, although they're excellent at their job, they don't always appreciate the overall effect that a cosmetic change or a new filling or a new material or a new type of treatment, be it in a surgical environment, an implant environment, a cosmetic environment, can play in the role of the patient. And if they have that little knowledge, even over the telephone, they can pass it on. Invite the patient to come in, have a quick look at this program. What will that do to the practice? What will that do to their position in the team staff? Maybe it will escalate their role.